Thank you everyone for joining us tonight and taking the time out of your day to come learn with us. I'm really excited to share this presentation. And so as Kristen said, my name is Deidra and I'm a physiotherapist, and I've had the great pleasure of working with pediatrics for quite some time now. So it's a really fun and awesome field to work with. And so I'm going to go ahead and share my screen so that we can go ahead and start the presentation. And again, so as Kristen said, we're going to be looking at movement and milestones, so what you can expect to see from your growing little one between the ages of 0 to 12 months. And this little cutie on the right here is my niece Blair. So she's our model for tonight. So I have a few videos of her to share with you guys to kind of demonstrate some of the things that we're going to talk about. And then I also have my little mock baby at home too. So lots of demonstrations tonight, which will hopefully help and complement what we're going to go through. So just for an overview of what the presentation is going to include. So I'm going to talk a bit about Blueberry Pediatric Physio and different clientele that we see that Kristen also briefly touched on. We're going to go over the expected physiological development and gross motor milestones, and then help you guys to kind of recognize when you should maybe seek out help from a physiotherapist, and then what that physiotherapy assessment and treatment will look like for you and your little one. And then we will have time at the end to go through questions. And again, as Kristen said, you can also enter them into the chat box as we go. So at Blueberry for pediatric physio, so children that we work with are children with torticollis or plagiocephaly. So torticollis is when there's a short muscle in the neck, and it can cause a child to hold their head with a bit of a tilt or have a preference to strongly look in one direction pretty consistently. And then we often see this with plagiocephaly, which is basically just a big word for a misshapen head. And so if your child has a strong preference to always look in one direction, they spend a lot of time on that side of their head, they can develop a flat spot. Or if they just spend a ton of time on their back, then the whole back of their head can become flat. So we can help provide strategies to prevent that, but then to also help treat that. We see children with neurological conditions such as cerebral palsy or spina bifida, genetic syndrome, so Down syndrome, or chromosomal abnormalities, orthopedic presentations, so as Dina is going to be presenting on toe walking or in-toeing, or if a child's had a recent fracture and they need post-op physiotherapy, we can see those children as well. Developmental delays, and if that's accompanied by a gross motor delayed, and it doesn't necessarily have to have a diagnosis. But all in all, what we really do is we treat movement. So we assess and we observe how the child is moving, and then we base our treatment and our recommendations off of that. So now the meat and potatoes of the presentation. So expected development and gross motor milestones. So what I really just want to emphasize off the bat is that there's going to be a huge range in the sequence and the timing that children acquire their gross motor skills. And so I'm going to be going through specific time points and what you can expect to see. And this is based off of when the majority of children acquire these skills. So kind of the big part under the curve here. But what's important to know is that you're going to have some children who acquire these skills really early, so over on this side of the curve, and then some children who acquire them really late, so over on this side, and it's still all considered typical. So whether your child's chilling and relaxing and taking their time to hit their milestones, or they're a go-getter and they're really quick, what we really just want to see is a trajectory and that they're following their own curve, so they're continuing to make progress as they grow. So I've broken it down into a few different age categories, and then into what you can expect to see when they're on their tummy, on their back, when they're sitting, and when they're standing. And this is kind of often how we break down our assessment as well. So 0 to 3 months, babies are pretty relaxed. They're not moving around too much. So on their tummy, you might see that they are starting to lift their head off the surface, and they might be able to turn it a little bit. On their back, you're going to see spontaneous arm and leg movements, and they may be able to hold their head in midline. So that just means in line with their trunk. And they can start to bring their hands to midline too. So if you hold a little toy above them, they might bring their hands together to grab the toy. They're going to require lots of support in sitting at this time for both their head and trunk, and they're going to have a rounded back. So with my little baby model, they're going to be kind of this way instead of sitting nice and straight up. And if you let them hold your fingers and you go to pull them up into sitting when they're lying on their back, you're going to see that their head lags back. So they don't quite tuck their chin in yet. And then in standing, they're able to bear weight through their legs, but this is more reflexive than anything. So as I said, I have some fun videos of our baby Blair. So in this first one, and I've taken the sound off of the videos just so I can talk through them. So this first one, she's doing tummy time. So lying on a parent's chest is still considered tummy time, but you can see she does a little head lift there and a little bit of turning. And that's very typical for this age, to just be doing those small movements like that. And then here on her back, you can see she's moving her arms and legs lots, she's kicking them, and they're just kind of spontaneous and not necessarily purposeful movements, but we're seeing it in both arms and both legs, which is also what we want. And then this last one, so you can see right off the bat that she's doing a nice job holding her head in midline, so in line with her trunk. But then you can also see that she's got her hands in midline too, so and she's really cute and smiley. So she's bringing her hands to the middle of her, so in towards her chest together, which is another thing that we look for. So you can see they come apart and they come back together. Okay, so now you can see our chart's getting a lot bigger. So we're starting to see lots of new movements around the 4-month mark. So on their tummy, they're going to be lifting their head a lot more, and they're going to be able to maintain this head lift longer. They're going to start to prop themselves up on their arms. So that can either be on their elbows and their forearms, and then you'll see them progress to pushing up through their hands and straight arms. When they are on their forearms, you might be able to see them reach for a toy. If they do roll onto their back, it's often accidental at this point. And rolling onto their backs can sometimes be a little scary because they can't necessarily see where they're going. So this one takes a little bit longer to acquire versus rolling from their back to their tummy. We'll also see swimming, which is kind of like the Superman position. So they lift up both their arms and both their legs off the ground, and they're just resting on their tummy. On their backs, we'll see spontaneous arm and leg movements again, and holding their head in midline, bringing their hands to midline. And then we'll also start to see that they're going to reach their hands. They're going to reach their hands and their knees or feet together. So we call that movement flexion. So for us, it would kind of be the equivalent of us doing a sit-up or a crunch. They are able to roll onto their side or all the way over onto their tummy. And we'll start to see that they can bring their chin down towards their chest. So again, that's a flexion movement. And maybe even lift their head a little bit off the ground. That's pretty hard though, because when babies are still tiny, their heads are pretty big relative to their bodies. In sitting, they're still going to require support for head and trunk, more so for their trunk than their head. And then that rounded back posture is going to improve a bit. So they'll have started here, and they'll start to kind of be able to straighten up a bit this way. When you go to pull them up to sit, you'll notice that their chin tucks a little bit, so it's a little bit less of a head leg. And when they are in sitting, as I said, they're going to be able to sit up a bit more. And they might even start to prop themselves up with their hands. So placing their hands on the floor in front of them to help support themselves. They continue to bear weight through their legs when you're holding them in standing, and they will straighten their legs, but then they will all of a sudden drop them. So you have to be a little careful with that one. And then I've also started to include arm and hand use. So this is something that we look out for as well. So they'll start to bring their hands towards their face. You'll see increased coordination. So if you put a toy on their tummy, they have a bit more accuracy in reaching for that toy. They'll grab toys, but they're not yet transferring them between their hands. And they're more likely to bring their mouth to a toy rather than a toy to their mouth. They also might, if you're holding the bottle kind of right in front of them, they might bring their hands to the bottle and not holding it independently, but with your support. So I have a few more videos. So in the first one here, we'll see that Blair's doing a really great job lifting her head up, and she's propped up on her forearms there. But you can see she still kind of lets it drop a bit too. But she's able to hold it up for a longer period of time, and it clears the floor really nicely. And then in our second video, we're going to see her reaching her hands, bringing her hands and her feet together. So this is, oh, sorry. She's playing with her dad, Rory. So you can see he's playing with her, and then she brings her hands and her feet together. So that's really nice. Like I said, we're looking for that flexion activity, and that's telling us that she's starting to develop some good core muscles. And actually what Rory's doing here, kind of playing with her feet, is a good way to encourage this movement. I don't think he knew that, but physiotherapist in the making. Okay, so on to 6 to 7 months. Am I going at an okay pace, Kristen? Any questions that we need to stop and address yet?
Great, Deidra, and we don't have any yet. Again, just to the participants, feel free to put anything in that chat line and I will bring it up.
Okay, perfect, thanks. Okay, so 6 to 7 months on their tummies. So they're gonna start to attempt to bring their knees under their chest to get into that hands and knees position. And if they do come into their hands and knees, you might see them rocking. So kind of going back and forth between shifting their weight between their hands and their knees, which is a good precursor for crawling as well. We're going to see more so that when they're on their tummies, they're able to push up right through their straight arms. So kind of that like cobra yoga pose. And then from here, we might see that they're able to shift their weight onto one hand to free up their other hand to reach for a toy. Pivoting is basically just turning in a circle on your tummy. So you'll see that their trunk kind of curves to one side and their arms and legs work together to turn them. So that might be to, again, reach for a toy or to see something interesting. Their head control is fully developed. And we may also see them pushing backwards on their tummy. So again, they're just trying to figure out and explore different ways to move around in their environment. And we can also see creeping. So this is not yet crawling, so they're still resting their tummies on the ground, but they're pulling with their arms, pushing with their legs, so almost like an army crawl. On their backs, you might see that they can start to bring both of their hands to one foot, so we'll see them crossing midline, which is something that we again look out for. And when they roll, so previously when they rolled, they more so led with their head and their back. So they would kind of extend their head back, arch their back, and that would help them to roll over. But now they're more so going to reach across their body with their arm. They might tuck their legs up and in, and that's going to help them roll. So that takes a bit more core control again. But really around this age, you won't see them spending much time on their back. So they often will just roll right over onto their tummy, because it's a bit easier way to start exploring their environment. In sitting, we can see ring or prop sitting. So ring sitting is just their legs are bent out in front of them, so it kind of makes a ring shape. And that's just to offer more stability because it's a bit bigger of a base of support. And then we'll see that their hands are propping them up too. And then from there, they may also be reaching for a toy. But you'll still see them often tip over in these positions. So especially if they go to look behind them or look over to the side, this challenges their center of gravity and their balance, and they might just tip right over. They might be able to do independent sitting for a few seconds, but again, they'll likely either come back to prop sitting or they're going to topple right over. And they're going to start to go from sitting onto their tummy or their hands and knees. So they're starting to make transitions between postures and movements, which is great. In standing, they're taking more weight through their legs. They're going to start to do that bouncing. So instead of just going from straight to bent legs, it's a bit more controlled, so they're moving a bit more rhythmically almost. They might try and pull up to stand at a surface, but that would be mostly using their arms for strength. And if they're leaning against a surface, so their hands against it, they might be able to reach one hand up. When they are standing against a surface, they don't quite yet have the leg strength to lower themselves to the ground. So you're going to see that they just kind of start to lean away and plop down. And they may, if you're holding your baby by their trunk, they might try and take little steps. So that will mostly look like they're going to lean forward with their upper body and then their feet will follow. With their arms and hands, they're going to have increased accuracy with reaching again, and now they have a bit more of a controlled grasp and they're holding objects a bit more tightly and intently. And they can reach with one hand on their back. So instead of bringing both of their hands up to their face, they can do it with just one, which is another important thing that we want to see, that they can start to dissociate left from right. Okay, so a few more Blair videos. So in this first one, I included it just because you can see her bringing one hand up to her face. So again, that dissociating her left from her right side and understanding that what she does with one hand doesn't necessarily have to be what she's doing with the other hand as well. And then this is a really great video of her. You can see her, you'll see her bum kind of lift off the ground a bit. So right about, oh, there's Penny, their dog. So right here, you can kind of see she's trying to lift her bum off the ground and tuck her knees under. And she's doing that creeping motion. So her belly's still fully supporting herself on the ground, but she's reaching with her arms, she's kicking with her legs. She's trying to get to Penny. Alrighty, so moving on to 8 to 9 months. And so you can see in this section, tummy and back are a lot smaller columns, and we start to see more of the movement progression in standing. So on their tummy, they're going to assume and play in the hands and knees position. Or we also call that 4-point. And so that's telling us that their core muscles are developing, they're gaining strength. And they're going to start to crawl, which requires a lot of coordination and again, strength. Really good arm strength is needed for crawling. And one thing that families will often ask us about is if they have a child who isn't crawling, they just are not tolerating it. And they'll often say, you know, my child just is going to skip crawling, they're going to go right to walking. And is that okay? And you might get different responses from different therapists. And if Kristen wants to pipe in, she can. But I just like to provide education to my families about the benefits of crawling. So it's really important taking that weight through their arms to develop the musculature around the shoulder girdle. And because those are essentially the muscles that are going to help us when we are like if we were to fall later on in life or as they start walking. So those are muscles that help catch us and bear the load through our arm joints to protect our joints. And as I said, crawling is also really important for developing coordination and trunk control. And so, not that I discourage a child from walking. If they're starting to walk, then that's great. We want them to be able to function in their environment. But I just often then provide strategies of things that they can work on to still work towards that crawling and hands and knees position and to develop muscles around the shoulder girdles.
Deidre, I totally agree. It's Kristen. And one of the things that I also talk to parents about crawling is development of cross lateral patterns. So,
Mm-hmm.
as you move with the right hand forward and the left knee, that's a different part of the brain that gets activated. And we know that those are really important for developing different neural patterns and neural pathways. So there's so much about crawling that's great to do that I'm a big believer in it too.
Yeah, definitely. Thanks, Kristen. And kind of going off of that, even when you think about walking, you take a step forward with your right leg, but you swing your left arm. So, yeah, it kind of all translates to skills in the future as well. Um,
And Deidre, there is a question. Would army crawling provide
yeah.
the same benefits, or does it have to only be hands and knees crawling? That's the goal in order to get those benefits.
So, army crawling does have benefits in that, kind of again, what Kristen was saying, that contralateral coordination, so moving one arm with one leg. But in terms of development of those muscles around the shoulder girdle and core control, you'll see more benefits from crawling on hands and knees than army crawling, if that makes sense.
Does make sense. And so as a follow-up to that, then if your baby is army crawling, how do you get them to 4-point crawl, or will you address that a little bit later?
Yeah, I can address that right now. So, really, what you'd want to work on first is just getting them to play in that hands and knees position. And so, one way that you can start to do that is have them supported either with a rolled up towel under their tummy, or they can play over your legs so that they're in that hands and knees position, but you're providing a little bit of control for their trunk. So, they're not having to do all of the work. And then you progress that to decreasing the amount of support, so then, when they're able to play on their hands and knees on their own, you're then going to encourage them to start reaching with one hand in that position. Because again, when they're crawling, they have to weight shift back and forth between from hand to hand and leg to leg. And that's going to be more challenging for their core and for their arm strength. So we can break it down into that, getting them to reach for a hand or a toy with one hand so that they're bearing weight just through the other hand. Um, and then we can go through some actual hands on facilitation of the movement. So, moving one arm forward and one leg forward and doing the opposite on the other side. So, yeah, we kind of break down the skill and target smaller movements to work towards that final destination of crawling altogether.
And I think the one other thing, those are all awesome, and we definitely work towards those. However, the other thing that sometimes kids are missing when they're on their belly is that they don't have terrific low back or even upper back support, right? So sometimes working in different positions, so making sure that they are independently sitting
Mm-hmm.
translate to them being able to actually prop up into a crawl. And so thinking about all the muscles that you need to get into that crawl and all the different ways that you can work the child, right? In fun
Yes.
ways, which Deidre, I know always.
Yes. Yes, we try our best to make therapy fun. Okay, thanks for those questions. Those were really great questions. Um, okay, so just the last point under the tummy. So you'll also see that your little ones might start to climb upstairs in furniture, but not yet down. And so I also like to just warn families that if they start to crawl upstairs, that's awesome, but they'll often turn around to come downstairs face first. So you just want to make sure you're very close by. There's not much under the back section because really, as I mentioned previously, they like to roll over right onto their tummies to explore. In sitting, they're going to start to sit independently, but they may still tip over a bit, so they might not have all of those balance reactions to catch themselves. And they're mostly ring sitting. So again, that's kind of with both their legs bent out in front of them. But they might also long sit, which would mean that their legs are straight out in front of them. They can start to turn in sitting as well. They might assume side sitting, which is one leg bent out in front and the other leg bent out behind them. And again, they're going to become more proficient with transitioning from that sitting position onto their hands and knees. In standing, we can start to see that they're going to pull up to stand at surfaces again. And that might be, you might see them pulling lots through their arms and coming up onto both feet at the same time, or you might see that they're going to bring one foot forward and then the other and push up. And the latter is what we hope to work for. They can play in kneeling and half kneeling. So half kneeling just means that one knee's on the ground and the other leg is forward, so kind of like the bottom of a lunge. They can rotate when they're in standing, and they can start to squat to lower themselves, but they don't usually squat all the way to the bottom. They'll start to squat and then they do that plop again. We'll also see cruising, which is with their hands on a surface, they're going to take side steps. And they might also stand just holding a parent's hands or fingers. That's a little bit harder because they don't have a surface in front of them to lean their belly or their trunk against. And we will see in standing that they're going to have that wide base of support. Their feet might be turned out a bit because they're trying their best to be stable and balanced in that position. For arm and hand use, again, so they're going to be manipulating toys, transferring them between hands, and they're also going to start to release a toy at will. They can have a toy in each hand and bang them together, and they can transfer toys from one hand to the other hand.
Deidra, just another
Yeah.
question before you move on. How to help a baby who has locked knees when standing, which prevents the baby from either squatting or cruising?
Yeah, okay. So again, there's lots of different things that you can do. And one of them even being working on that hands and knees position. So again, kind of getting used to those different weight bearing positions through the legs. So even when a child's on their hands and knees, they're still taking weight through their legs, just through their knee up to their hip joint. So that's a good one. And then you can also help them do it manually, so kind of pushing against the back of their legs and to help them slowly lower down. So pushing almost one leg so that it bends and then helping the other one come down onto their knee is a good way. I often just see if when you're holding or when you're playing with the child there and you have a toy, will they try and squat down and reach for the toy? Um, and then working in the opposite direction. So working from going from standing up to sitting. So you can have your little one maybe sitting on your lap, and in front of them is a surface like a couch or a coffee table that they can then pull up from sitting on your lap, and they can pull up to standing. So we're still working on that leg strength and developing leg strength, just in the opposite direction. Those are a few things.
You've got a few more. I mean, just to comment on that, I mean, we do see lots of kids that stand with really straight legs, especially initially, because it is a very strong position, and it is when you stand, your femur stacks over the tibia, and it's a position of strength. As soon as you break the knee, not break the knee, but bend the knee a tiny little bit, your muscles have to kick in. And that's hard for kids. It's like it's a stage that they need to learn. So if it's just a stage and they're doing that for a little while, it's part of their developmental stage that they're learning. So all the things Deidra just mentioned are perfect. But I wouldn't be concerned if they're doing it for a period. Yeah. One question, is 4 months too young to practice standing?
I guess there's no harm in it, but it's not something that we're looking to achieve either. And you do want to make sure that if you're holding your baby in standing, we want to make sure that they have their head controlled too. So we don't want their head to just kind of be plopped forward or falling back. But if they have good head control and they're taking that weight through their legs, there, yeah, like I said, there's no harm in it.
Perfect. Thank you.
No problem. Thanks for the questions. So I have quite a few videos now, just because this is a big stage in development. So this first one, we're going to see Blair playing in the kneeling position. And we'll see her, she kind of ends up lifting her bum up off the back of her legs too. And she comes into the hands and knees, which is nice. Yeah, so you can see her kind of lifting her bum up. She's using her arms lots too. So that's pretty standard that you're going to see them using their arms lots to help. And then here at her little play table, this is where we see, so she's standing really nicely and she's just supporting herself with one hand and she's able to rotate her trunk. So she's shifting her weight, she's challenging her balance, which is awesome. And then you can also see she's kind of taking, almost marching on the spot there. Here we have her with her grandma climbing up the stairs, which again is really great. And then grandma's very careful to bring her back down. And then this one's just quick. It shows her squatting down and turning and standing. There she goes. She squats down. And she actually does a really nice job there of not plopping down. But as I said, you might see them, you're going to see them plop down to start just because they are developing that lowering strength of their legs. This is another great one. So it shows her kind of cruising along this little bar here. She'll do it in a second, but you can also see she's got a wide base of support at her legs. She's lowering herself down nicely and she's able to come back up here. But she's reaching and standing. So again, she's shifting her weight between left and right. She's challenging her core and pulling up to stand. So on that one, you could see she brought one leg forward, then the other. But she does do it again in a second where you'll see that she pulls up and both her legs come up at the same time, which is also normal and it's not a concern. We do want to see that eventually they're able to bring one foot forward then the other. So here she comes up with both feet at the same time. And then I wanted to include this video. So it first shows her going from sitting, transitioning from sitting into the hands and knees position, but she does a bit of a modified crawl. So she's on one knee and then she's pushing with the other foot, which again is very typical, and it's them kind of exploring how they can move and see if they can move around faster. So she's sitting here, she transitions, and there she goes. She's kind of kicking off with one leg, she's on the knee on the other leg. And so yeah, I wanted to share that one just so that families know that that is okay if you see that. Okay.
We've got another question too.
Yeah, sure.
About jolly jumpers. So what are your thoughts about jolly jumpers? And are you at all concerned about toe walking and kids that are in jolly jumpers?
Good question. So jolly jumpers, like many other positioning apparatuses, so like a bumbo seat or your little like play walkers that they sit in, they have a saddle. I totally understand parents are busy and sometimes you need to be able to have your hands free. But what I recommend to families is if you're going to use them, to just keep it to a very short duration, so 10 minutes or less. And this is because often these pieces of equipment don't promote great posture. So for example, a bumbo seat, you'll often see that the child, their pelvis is tilted back, which creates more rounding of their spine, which is not the optimal posture we want them to be in. We want them to be up nice and straight. And so the same thing kind of goes for a jolly jumper. We don't necessarily have that the same weight bearing through the legs, first of all, but that same alignment that you would get if they're working on standing outside of the jolly jumper. And I haven't, at least in like especially in research, I haven't come across much of a correlation between using a jolly jumper and the prevalence of toe walking. Um, but toe walking in general, or going up on their toes, is something that we always do keep an eye on. I'm not sure if those two are related or not. I haven't come across that at all. But like I said, we try and limit, or we advise to try and limit the amount of time spent in equipment such as a jolly jumper, just so that we can promote more neutral and optimal alignment as the little ones taking weight through their joints.
And I agree. And I haven't seen literature on that either, Deidre. What I do know is that, as you say, lots of kids come through kind of like toe walking at a point where they're experimenting and playing with it. But one of the things that I often say to parents is you can lower that jolly jumper so that the kid comes down so that they're flat footed as well, so that they have to actually push up
Yeah,
a little bit higher. And you can do that with lots of different kids' toys. Just a quick clarification.
definitely.
Would you recommend that they only spend 10 minutes per day or 10 minutes at a time per day? What are you thinking there?
I would say more so 10 minutes at a time, but then not very many bouts of it throughout the day. So 10 minutes at a time, and maybe 3 or 4 times a day, um, if that makes sense.
That makes perfect sense. And I think that's just, it's with any position, right? That we're trying to
Mm-hmm.
expose your kids to lots of different positions. They learn from seeing at a different level, from being on all fours. And so in and out of equipment, and in no equipment at all throughout the day makes a ton of sense.
Mm-hmm. Mm-hmm. Yeah, definitely. And that's something that I'll have a lot of parents ask too. For example, when if their child's not tolerating tummy time, and we start to work on that, and I let them know that it doesn't have to be a long duration that they're practicing this skill or spending time in this position. It can be very short bouts. You can start with just 1 minute, and we're really looking for more of the quality of the movement than the quantity. But as Kristen said, spending time in lots of different positions is what we're really aiming for.
Okay, hold on. You got a bunch more.
Okay.
Keep them coming, guys. This is awesome. So I think I can answer this first one. Is the advice for exercise the same as the jolly jumper? And that would be yes. Uh, it's interesting. I years ago worked at the Children's Treatment Center in Brantford, and I saw a family who didn't was struggling a little bit. But the child loved the exerciser, and they would plop this little girl in the exerciser for like hours a day. This child at a very young age, loved to stand, but if you sat them on the ground, would fall right over, even at like 8, 9, 10 months, because didn't develop any of the core stability in a seated position. So the advice is the same, right, Deidra, for jolly
Yeah.
jump, exercise, or bumble. Okay. So is 4 months too young for an exerciser?
So, as kind of similar to the previous question asking about standing, we do want to see that that child has developed pretty good head control, so their head's not kind of bobbing all over the place, especially because it's not that stable of a piece of equipment that they're going to be able to move around lots. So I would say if their head control is pretty good and they're able to hold their head up, then there shouldn't be an issue. And again, just kind of keeping it to a short duration.
Yeah. Uh, and then there's another one here. My 20-month-old just recently started toe walking. Previously, he was walking normally. Is there anything that I can do to encourage him to walk properly again?
Okay, yeah, good question. So one thing that I'll ask families is, do you notice a difference when they're wearing shoes versus when they're not wearing shoes? Sometimes having those shoes, sorry, I'm going to go back a second. So sometimes, as Kristen was mentioning, a child will go up onto their toes. They're really exploring that, how to feel balanced in this new standing position. And so sometimes the shoe can offer a little bit more of that support and stability. And so you can see if even by just putting a shoe on them, if you have a high top shoe, that's great. You can see if that's going to make a difference. They're not quite at the age where you can say to them, come down on your flat feet. So it's more a bit about external cues that we can give them, such as wearing a shoe.
Thanks, Deidra. Sorry, that's good. Keep going, lady.
Okay. Okay, so this is the last age range that we're going to look at. And you can see I took position or the back position right out of it. So on the tummy, we're seeing continued crawling, and they might be able to have a toy in both hands or in either hand. They can crawl up and over obstacles, and now they are going to be able to start trying to come downstairs. So we want to see that a child comes down their stairs on their tummy, almost like as if you were to rewind them going up the stairs. This is just the safest position to do this. They're moving in and out of sitting lots, a variety of sitting positions, and again, they're able to turn their bodies a bit more and challenge their balance without tipping over. And standing is where we're going to see a very wide range of when children acquire these skills. And so it can range from them still just only being able to stand with their hands on a surface to momentarily being able to lift their hands up and stand independently, or to fully standing independently on their own. And we'll often see that, again, that wide base of support for more balance. You'll see their toes curling again. That's to increase their sense of balance and stability as well. And you'll see their arms are kind of in high guard. We will see them rise up on their toes. And so this could be, and from a strength aspect, we're seeing that they're able to push up onto their toes, like to reach for a toy or something. And then eventually we want to see that they do assume a flat foot position pretty consistently. They'll lower themselves down through squatting. They can cruise forward. So this means they'll have one hand on a surface beside them, but they're taking steps forward. And then there's a huge range with taking steps again. So they can maybe be taking steps holding onto their parents' hands, or taking steps completely independently. And then another safety thing I just like to tell families is if you're practicing taking steps with your little one, just to not hold their hand above and behind their shoulder or their head, just because this puts the shoulder in a vulnerable position for injury. So just try and always keep their hands in front of them. And they may try and stand up without having to pull up on furniture, so standing up right in the middle of the room. For arm and hand use, they can take toys in and out of containers. Their hands can be doing different tasks. So one hand might be taking the lid off a container while the other one's picking up a toy to put it in. We'll start to see development of that pincer grasp. And one thing to note too is that you're likely going to see a difference in what they're doing with their arms and hands in sitting versus standing, just because standing is a lot more challenging for their core, their balance. So they're focusing so much on that they can't do as many tasks with their hands. So that might be a difference that you see. So these are my last Blair videos. So this one on the left are some of the first few steps that she was taking. So you can see her hands are kind of held out to the side, very wide base, and just a few at a time. And then the second one, we'll see she's standing independently. She's able to squat down, and we'll see in a second that she then stands right back up without having to pull at anything. So there she goes there, and she's walking. And again, so you see that wide base of support, which is very typical, and the occasional little trips and falls. Okay, so when to see a physiotherapist. So I've broken this down again into age ranges, but wider age ranges, because as I said, there really is a lot of variability in when we see children meet these milestones. And so I don't want you guys to leave worried that if your child isn't doing a certain motor task by this age, that you should be concerned. We really, again, just want to see that they're making steady progress. So I've kind of increased the age ranges. So 0 to 3 months, that torticollis or plagiocephaly, so the neck tightening or the shape of your baby's head. We can help if your baby's not tolerating tummy time or other positions, and if we're not seeing any spontaneous arm and leg movements or head lifting. From 4 to 6 months, if they're not rolling or they're only rolling one direction, which might be related to torticollis. So if your child really has a tendency to only look one direction, they're going to be more likely to roll that direction as well. If they're not yet lifting their head in tummy time or holding their head up and sitting, so if we notice that they might have some decreased head control and neck strength, and then difficulty taking weight through their arms on their tummy. 7 to 10 months, so if they're not yet independently sitting, so this is more towards the 10-month range, with or without arm support. And if they're not taking weight through their legs or they're not coming onto their hands and knees. And then 11+ months, so if they're not yet pulling up to stand, cruising, crawling, independently standing past 12 months, or taking independent steps from about 14 to 16 months and on. And as I said, it's a range just because there really is a lot of variability in when children kind of work through all their different gross motor milestones. And then just some things to check or to keep an eye on throughout development as well. So if you're noticing asymmetrical use of their arms and legs, so they only seem to be moving either their left or their right side, or they're only grabbing toys with their right hand, or they're holding one hand clenched and the other hand's open, that's a good time to consult your physiotherapist. If you notice stiffness or tightness in any of the limbs, so this can be especially noticeable during diaper changes if you're noticing that's really difficult to lift your baby's legs up, which kind of goes along with a continued pattern of extension as well. So extension is that arching of the back and bending the head back. So if your baby is doing that, it's going to be really difficult to lift their legs up to change their diaper. And we want to see that they can break that pattern of extension. So as I was talking about before, those flexion patterns, so tucking their chin in, reaching their hands and feet together, we want to see that they start to acquire those flexion skills. If you notice a plateau in their skill acquisition, so they're doing well, they're progressing, and then all of a sudden they kind of hit a flat spot. And then, of course, if you just aren't sure, if you're just seeking reassurance that everything is going well, or you just want some strategies to help your child progress to the next steps, we are always open to helping families and meeting with you guys and meeting your little ones.
And just on that note, I mean, we have lots of people come in kind of for that reason. And I think as parents, especially, we have kind of a gut feeling sometimes that something's just not quite right. And it might not be anything bad, but I mean, what our pediatric physiotherapists do well is analyze movement. We use sometimes like a Peabody gross motor screen, so we can see, you know, your 4-month-old, how do they register and do certain skills against, you know, lots of other 4-month-olds, and we can tell you, oh, actually they're doing really well with this, but these are the things that you might want to work on in this area. So remember, if you have physio benefits, your child does too, and sometimes it's just nice to have that other set of eyes.
Thanks, Kristen. Yeah, for sure. So what does physiotherapy look like if you end up seeking out a referral? So physio's famous last words, so it all depends. It all depends on what your hopes are from physio, what your child's presenting with. And so we like to really work with our families to figure out what the best plan of action is with them. But for all children that we see, we do a multi-system assessment. And what I mean by that is motor skills require multiple systems. So our musculoskeletal system, the system of our bones and our muscles, our vestibular system, which is all about our balance and maintaining equilibrium, and also our sensory system. So getting into all those different positions is providing really great sensory input for our brain, and that works together with our motor system to achieve new skills. So we perform an assessment, and then from there, if we think that your child would benefit from physio, there's a few options. So we can do more of a home program with consultation. Um, so it would be more so the families implementing exercises at home. Or we can do more active treatment. And so I'll show some videos of what's called Cuevas Medic exercises. It's a really cool type of therapy that I've had the pleasure of taking a few courses in, and it's very active therapy. But again, regardless of the techniques that your therapist uses, we're analyzing the movement and then we're helping progress the movement. And as I kind of mentioned throughout, we're working with you and your child's healthcare team to achieve your goals for your child. Okay, so this is Amy. This is one of my clients who was okay with me sharing some videos. And so she has cerebral palsy, so a neurological condition. And like I said, it's a very active type of therapy. And so here it kind of works off of challenging equilibrium or a sense of balance to elicit a motor response. So I'm almost lifting her upside down, and then when I place her in standing, you can see she has a really nice reaction where she was standing upright, and she's working really hard here to maintain upright standing. And then in this video, we can see she's standing really well, and you'll see I'm able to kind of lift my fingers off her legs, like she's not relying much on my support. So her standing balance is doing really well, and she's reaching, her core is working really hard. So she's doing awesome. And then this is another technique to work on core strength again, to transition from lying up to sitting. So that's just an example of one type of therapy I thought I'd share, just because not many people have heard about CME. And that's the end of what I have to share.
Deidra, that was awesome. Thank you so much for that presentation.
Yeah, no problem.
I think at this point we don't have any questions in the chat, but if people want to enter more questions in the chat, feel free to do so. Or if you want to unmute yourself and ask, that's certainly an option. And remember that this will be posted again on our Blueberry Therapy YouTube site. If you had some questions or wanted to look at those charts, those were great, Deidra. A nice way to break it down.
Thanks.
Hi, can you hear me?
Yes, go ahead.
Hello.
Hi, I have a couple of questions. So our daughter is 10 months. She's actually already working with a physio at Ron Joyce, but it's only like monthly appointments. She basically isn't doing anything of the tummy stuff. So she's not really pushing up on her hands. She's not pivoting or anything like that. So one of the things we're wondering is, like, I don't know if she's made the connection about like moving is a thing. I don't know if you have any, I know maybe not so much a physio thing, but I don't know if you have anything you can comment on helping her make a connection between like and actually move. Yeah.
So just so I'm understanding your question right, so kind of helping her realize different movements that she can do and different ways that she can move.
Well,
no, she just doesn't really have the concept that she can put herself somewhere else.
Okay, so she almost gets stuck in positions.
She's not ever aware that she's even stuck, I don't think.
Yeah, so she just won't reach for a toy, but I don't think she has a concept that, oh, I could move my body to get to that toy, if that makes sense.
Right, okay. I mean, it's a bit tricky without actually seeing her and seeing how she's moving. and knowing kind of the movement stages that she's at. But I think an important part of what her movement would look like too is also that sensory piece, bringing awareness to what it feels like to be on her tummy, to be through taking weight through her hands, and through her legs. So it would be, my guess, a lot of different positioning to bring awareness to different positions she can assume and different ways that she can take weight through her joints. And likely you would be doing a lot of like manual facilitation of movements as well to help her learn those motor patterns and kind of integrate those and include those in her library of things that she can do. So like I said, it's a bit tricky without knowing exactly what she's doing yet. But that's where I'm thinking that I will probably start with her, is different weight bearing.
I think even though we're seeing physio at Ron Joyce, I mean, can we also like come and see, like, is it going to be a problem seeing 2 different physios at once, or is that something we could kind of double up on her care? Like,
no,
as well.
Yeah, you can definitely do both. We have quite a few clients who are both seen at Ron Joyce and at our facility, especially because Ron Joyce is a bit more limited in how often they can see children. So absolutely, that's a possibility.
Okay, and then one last question, just in terms of encouraging her to push up on her hands, because I think that's the next progress. What exercises might you suggest to like encourage that actually pushing?
Yeah, so just to go over a few quick ones. So you could start by having her lying on, so if you're sitting and your legs are outstretched in front of you, and you can put her tummy on your legs so that her hands are then overreaching onto the ground. This is one nice way because we're getting weight through her arms, but we're taking away some of the weight that she's putting through her arms. So it's a little bit easier. Her trunk is then supported. So she just has to focus mostly on taking weight through her arms versus also pushing her whole body up. So that's one way. Sometimes I'll even get parents to try like the wheelbarrow almost. Again, that will kind of depend on what her trunk control is like, because we don't want to see that it's majorly sagging, which is why the first one is nice because it will support her trunk. And I mean, it may even be if she's on her tummy, and you've maybe already tried this, but if you start to kind of hold a toy like higher and higher and higher, is she going to push herself up to follow it, or does she kind of stop? So even toys sometimes can be really motivating to encourage that movement.
Okay, thank you so much. I'm sure we'll probably be booking an appointment, but thank you.
Yeah, that sounds great. No problem. Thanks for your questions.
I think that might be it, Deidra. I just want to thank you again for putting together an amazing presentation, great slides, and just taking the time out of your night to do this. And for those of you still on the call, again, we are having another session in 2 weeks on more about walking and how to identify if there are issues with your child's walking, or if you just have more questions about walking and running and stuff like that. So that will be Dina Mercier again on a Wednesday in 2 weeks between 8 and 9. And then 2 weeks after that, I'm going to be speaking about pelvic floor and all things pelvic floor, not just for you, but for your kids and for your husbands and all that kind of fun stuff. So thank you everyone again. And we'll look forward to seeing some of you again. Thanks, Deidra.
Yeah, thanks so much everyone for